Assalamu alaikum everyone. Today we are going to discuss a very short topic, that is myxedema coma or myxoedema coma. It is a continuation of my previous video on hypothyroidism. So what is myxoedema coma? It is very rare, severe, decompensated presentation of hypothyroidism. There are some precipitating factors like trauma, infections in the body, cold exposure, narcotic drugs, and if the patient is non-compliant and not taking the medicines for hypothyroid. Also some cerebral vascular accidents and cardiac failure are also the precipitating factors for this myxedema coma. Remember, this is very rare condition and it occurs in approximately 0.1% of the cases, especially in older age greater than 60 years of age, and the fatality or the fatal rate is 50%. So the sign and symptoms or the clinical presentation in the emergency department is the patient has altered level of consciousness, hypothermia usually below 25 degrees Celsius, and convulsions, respiratory failure, hypotension, that is reduced blood pressure, and sometimes with the heart failure. In the CSF, the proteins levels are very high, and CSF pressure is also very high. It may be because of cerebrovascular accident or sepsis or any other infections in the body, because these features are not alone. These all features are associated with some precipitating factors, as we have discussed previously. So in the CSF, cerebrospinal fluid proteins levels are high and CSF pressure is also very high. Patient may have biochemical disturbance, that low levels of sodium or hyponatremia, and also hypoglycemia. So this is the clinical presentation of myxedema coma. Basically, it is nothing but severe form of hypothyroidism. Now come to its management. The management is usually conservative or symptomatic, and management should start immediately, even before the confirmation of diagnosis. So management or treatment starts before its confirmatory diagnosis. Give the patient T3, that is leothyronine 20 microgram IV 3 times daily, and then switch this T3 into T4 levothyroxine, oral levothyroxine or T4, 50 microgram per day after 48 to 72 hours of T3 therapy. Then the next management step is give the patient hydrocortisone 100 mg intramuscular 3 times, and this hydrocortisone should be given to the patient when there is a suspicion of secondary pituitary failure or there is a hypothalamic failure. So in the pituitary failure, along with the decreased TSH levels, so reduced T3 and T4, also there are reduced ACTH levels, that is adrenal insufficiency is also there. So in these patients, give hydrocortisone 100 mg intramuscular 3 times daily. And the other steps are slowly rewarm the patient, because the patient has, as we have discussed, reduced temperature of the body. So slowly rewarm the patient, give the patient IV fluids, and also broad spectrum antibiotics like ciprofloxacin IV or any other broad spectrum antibiotic, because of the triggering factors like sepsis or trauma. So these antibiotics should be given to the patient, and high flow oxygen to manage the respiratory failure in these patients. So this was a very little topic, and so this was all about myxedema coma. Thank you so much for watching this video.